Hi friends, welcome back to my channel Mukambika Nursing. Friends, in this video we can see important questions for exam preparation. Here we are preparing questions for ESIC, RRB staff nurse exam, also DSSSB, AIIMS NORCET, DME, Insurance Medical Service exam and JPHN exam. Surely these questions will helpful for your studies. We can see today's question. First question, how many seconds is the normal duration of a cardiac cycle? Option A 0.4 second, option B 0.6 second, option C 0.8 second, option D 0.10 second. Normal duration of a cardiac cycle is 0.8 second. Option C is the correct answer. That is, duration of atrial systole is 0.1 second, duration of ventricular systole is 0.3 second, and duration of complete cardiac diastole is 0.4 second. Normal. So the normal cardiac cycle is 0.8 second. And the next question, where is oxytocin synthesized? Options, option A hypophyseal portal plexus, option B hypothalamo-epiphyseal plexus, option C paraventricular nuclei of the hypothalamus, option D paraaxial nuclei of the hypothalamus. The question, from where oxytocin is produced or synthesized? It is from paraventricular nuclei of the hypothalamus. So the oxytocin is produced or synthesized from the hypothalamus and is released into the bloodstream by posterior pituitary. Okay, it is produced in the paraventricular nuclei of the hypothalamus. It's an important question. And the next question, how often oral care be provided to ventilator patient? Options, option A every 1 to 3 hours, option B every 4 to 6 hours, option C every 7 to 9 hours, option D every hours. And the correct answer is option B every 4 to 6 hours. We can see the next question. The anti-sterility vitamin is options, option A vitamin A, option B vitamin D, option C vitamin E, option D vitamin K. Which vitamin is known as anti-sterility vitamin? It is vitamin E. Option C is the correct answer. Vitamin E is also known as tocopherol. Its chemical name is tocopherol and the daily requirement for vitamin E is 8 to 10 mg. This is an important point. So the anti-sterility vitamin is vitamin E. And the next question, gland of Brunner's is located in option A jejunum, option B duodenum, option C ileum and option D none of this. Brunner's gland is located in duodenum. Option B is the correct answer. Brunner's gland or gland of Brunner's is located in the submucosa of the duodenum. And the next question, a nurse is caring for a client with hypocalcemia would expect to note which of the following changes on the electrocardiogram? Options, option A widened T wave, option B prominent U wave, option C prolonged QT interval, option D shortened ST segment. Here the question is, a nurse is caring for a client with hypocalcemia. Hypocalcemia means decreased serum calcium level. Normal serum calcium level is 8.6 to 10 milligram per deciliter. If it goes below 8.6 milligram, then it is hypocalcemia. The main ECG changes in hypocalcemia is prolonged ST interval and prolonged QT interval. Okay, here in our option, prolonged QT interval is there. So that is the correct answer. Option C. The ECG changes is prolonged ST interval and prolonged QT interval. So answer will come option C. This is in case of hypocalcemia. In case of hypercalcemia, there will be shortened ST segment and widened T wave may occur in hypercalcemia. Okay, hypercalcemia we can see shortened ST segment and widened T wave. And the next question, a nurse reviews a client's laboratory reports and note that the client's serum phosphorus level is 2 mg per deciliter. Which condition most likely cause the serum phosphorus level? Option A, alcoholism. Option B, renal insufficiency. Option C, hypoparathyroidism. Option D, tumor lysis syndrome. Here the question is, a nurse checked the gland lab report and note that patient's serum phosphorus level is 2 mg per deciliter. Normal serum phosphorus is 2.7 to 4.5 mg per deciliter. If 2 means it is below normal, that is hypophosphatemia. Hypophosphatemia means decreased serum phosphorus level. So here our question, in which condition we can see this hypophosphatemia? And here correct answer will come alcoholism. Alcoholism is one of the cause of hypophosphatemia. That means the client may experience starvation, also malnutrition, that is decreased food intake. During that time the phosphorus level will go below normal. Okay, and also if the person is consuming aluminum hydroxide based antacid or magnesium based antacid, if the client is consuming, that may also cause hypophosphatemia. Okay, and the remaining option, renal insufficiency, hypoparathyroidism, tumor lysis syndrome, these three are the causative factor for hyperphosphatemia. Okay, renal insufficiency, hypoparathyroidism and tumor lysis syndrome. And the next question, excessive stretching of muscles or tendon is known as options. Option A, sprain. Option B, strain. Option C, tear. Option D, none of this. Excessive stretching of muscles or tendon is known as strain. Option B is the correct answer. First option, sprain is there. That means excessive stitching or stretching of the ligaments is known as sprain. Here, stretching of the muscles or tendon is known as strain. And the next question, retrobulbar neuritis is a side effect of which of the following drug? Option A, ethambutol. Option B, isoniazid. Option C, pyrazinamide. Option D, rifampicin. Retrobulbar neuritis or optic neuritis is the side effect of ethambutol. Option A is the correct answer. And the next question, INH induced peripheral neuropathy result from deficiency of option A, vitamin B1, option B, vitamin B2, option C, vitamin B6, option D, vitamin B12. INH means isoniazid is a first-line bactericidal drug for tuberculosis. Here correct answer is option C, vitamin B6. Vitamin B6 or pyridoxine deficiency. Okay. The main side effect of this isoniazid therapy include hypersensitivity reaction, peripheral neuritis, neurotoxicity and hepatotoxicity, then pyridoxine or vitamin B6 deficiency. Because of this vitamin B6 deficiency, patient may experience peripheral neuritis. And the next question, a nurse must be aware that eating mice alone may lead to options. Option A, beriberi. Option B, scurvy. Option C, pellagra. Option D, phynoderma. Eating mice alone may lead to pellagra. Option C is the correct answer, because it may not contain vitamin B3. Vitamin B3 is niacin. Its deficiency may lead to pellagra. Pellagra is characterized by 3 Ds. 3 Ds means dermatitis, dementia and diarrhea. That also one of the important point. 3 Ds, dermatitis, dementia and diarrhea. So far we discussed important and previous year questions. Surely these questions will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle. Thank you for watching.